Hello, everyone. I am Nina Agbayani, Director of Programs at APCHO. On behalf of APCHO, I welcome you to today's webinar on the complex issues faced by nail salon workers and the important role community health centers can play in addressing these issues from a social determinants of health approach. Next slide. APCHO is a national association of 35 community health organizations dedicated to promoting advocacy, collaboration, and leadership that improves the health status and access of Asian Americans, Native Hawaiians, and Pacific Islanders. Over the last 2 decades, nail salon services in the United States have more than tripled. The majority of manicurists are women of color and of reproductive age, a significant portion of whom are of Asian descent. Every day at nail salons across the country, these women are exposed to harmful chemicals linked to serious health and safety issues, with many experiencing a range of health impacts. A recent New York Times article highlighting the plight of these workers has generated significant national attention to the health and safety of these workers. Next slide. During this session, you will learn about critical health and safety issues faced by the nail salon workforce and the impact of these issues on Asian American, Native Hawaiian, and Pacific Islander communities, community health center best practices addressing this issue, and community-based research approaches and studies on this workforce, and state and regional approaches to addressing nail salon worker health and safety. Next slide. Today's webinar is entitled Addressing Nail Salon Worker Health and Safety Through Community Health Centers, and we have a panel of speakers who will share their expertise on this issue. Tu Kwok is the Director of Community Health and Research at Asian Health Services in Oakland, California. And we also have Julia Liao, the Director of Program Planning and Development at Asian Health Services in Oakland, California. Next slide. We have Swati Sharma, the Senior Commercial Toxics Reduction Coordinator at the San Francisco Department of the Environment. And we also have Xiaoqi Sim, the Chief Strategy Officer at Charles B. Wong Community Health Center in New York City. We are honored to have this esteemed panel of leaders with us today and for the webinar. Today's agenda will include a 90-minute panel presentation and 20 minutes for Q&A. Next slide. Before we get started, I wanted to review a few housekeeping items and let you know how you can participate in today's webinar. Here we are looking at an example of the GoToWebinar attendee interface, which is made up of 2 parts. The viewer window, shown here on the right but maybe on the left of your screen depending on your browser or computer operating system, allows you to see everything the presenter will share on their screen. The control panel shown here on the left but maybe on the right of your screen allows you to participate in the webinar. By clicking the orange arrow button, you can hide or show your control panel. You can also set the control panel to auto-hide or not to auto-hide by going to the View menu. Next slide. Please note that attendees are in listen-only mode and will be muted during speaker presentations. You may submit questions in writing during the presentation by typing them in the questions field. We will be reviewing questions as they come in and will address them during the Q&A session held after the presentation. Today's webinar is being recorded, and you will receive an email with a link to view a recording of today's presentation after the webinar. With that, I'll pass the mic over to our first speaker, Tu, who will share critical health and safety issues faced by the nail salon workforce and the impact of this issue on Asian American, Native Hawaiian, and Pacific Islander communities, as well as community-based participatory research approaches.
Thank you, Nina, and thank you, APCHO, for this great opportunity to talk about this very important issue. Next slide. So before I start, I wanted to give a little backdrop and some context to why we've been focusing so much on the nail salon health and safety issue. In terms of cosmetics, we all know that it's used by a large proportion of the population, if not all. Women use on average about 15 cosmetic products per day, and the increased use in men has also been shown to grow dramatically. We've been using cosmetics since we were babies, and I think we continue to use it. So imagine that our exposure has been over long periods of time and during very, early stages of our life. Next slide. However, despite the long-term and widespread use of cosmetics, cosmetics aren't very well regulated, if at all. While cosmetics fall under the U.S. Food and Drug Administration, the FDA does not have the legal authority to do many of the things that they normally would do around food and drug. They can't require pre-market testing of products by manufacturers. They can't require necessary information from the industry for the FDA to even do their own pre-market testing. And products that are sold for professional use don't have to include ingredient labels. So really workers who are the most exposed can't really know what's in the products that they're using. And mostly manufacturers of cosmetic products can just voluntarily register their what they put in a lot of these products with the FDA, but again, there's no real regulation of that. What's been concerning was that, you know, back in the early 2000s or so, Europe started looking at a lot of these ingredients in nail care products or in cosmetic products and really identifying a few chemicals such as phthalates as ingredients of concern, saying, well, you know, the literature does show that there's enough to say that this can cause harm. So Europe decided to ban phthalates and a few other chemicals from any cosmetic products that are sold in Europe. When the U.S. turned around and asked the same manufacturers that had reformulated for the European Union to sell the same products, the initial response has been no. And that really got a lot of the environmental and breast cancer advocate groups to start looking at this issue and going, you know, what's going on here? You know, are we really paying attention to a lot of these ingredients are put in cosmetic products and the harm that they can cause to women and to others over long periods of time. And since then, there's been a lot of research into it in terms of even some of the makeup that's being used. You know, researchers have looked at lipstick and found that not only does it contain lead, but it also contains some of the metals. There was a huge cases with the Brazilian blowout. These are hair straighteners that contain high levels of formaldehyde and just weren't being reported, and workers and consumers were really reporting a lot of the health problems. And then we get to nail care products and sort of some of the chemicals that are included in nail care products and the health effects that they can have on the workers as well as consumers. Next slide. So why the interest in nail salon workers? We saw in the last few decades a rapid growth across the nation. We've been paying a lot of attention to California because of where we're based, but also the huge growth in California. The California workforce comprised over 100,000 licensed manicurists. And what I mean by licensed is that in most states, in order to perform hair or nail care or any of the beauty services, you have to be licensed by the state. It requires you to take so many hours of training at a beauty school and then go and take a test. And so a lot of the states will license workers or license manicurists or cosmetologists. Well, we found in California there were already 100,000 licensed manicurists and about 300,000 licensed cosmetologists, which is someone who can perform both hair and nail care services. Vietnamese immigrants are estimated to comprise about 60 to 80% of the workforce in California, and the vast majority of these workers are women. Next slide. So this is a graph that I was able to get the licensee file from the California cosmetology licensee. So in California, the licensee is really regulated by the Board of Barbering and Cosmetology, and I was able to obtain some of their files. And then on the figure 1 to your left, you see that cosmetologists, so those are anyone who's been licensed to perform both hair and nail care services, has been growing steadily since the 1970s. On the right-hand side in figure 2, you see that these are the actively licensed manicurists, and that you see a bigger rise starting in the 1990s. And in the shaded area, they didn't have race ethnicity, but I was able to look at the names, surnames, and first names of the licensed manicurists and cosmetologists, and you really see that in the shaded area that the Vietnamese really grew as a larger proportion of the manicurists over time. The latest year that I had was 2005, but you can really see that about that time they were about 60% of the workforce. Next slide. So a lot in terms of the workforce context and complexity that we're dealing with. A lot of the workers in nail salons may be brought on as contractors or booth renters. And before the ACA, there was a lot of concern that these workers lack a lot of health care benefits. Now with ACA, things may have changed a little bit. What's interesting is that these are often smaller mom and pop shops. So the owners often are the workers themselves and often facing the similar exposures. Yet one of the concerns we had is sort of how workers are defined by groups like the regulatory agencies like OSHA, the Occupational Safety Health Administration, and whether they could call in if there was a concern. In terms of workplace hazards, exposures weren't just limited to one chemical of concern. Often when you're doing occupational studies, you may focus on one or two chemicals. But in the cases of nail salons, you have multiple chemicals and workers being exposed over longer periods of time. They're working in salons that are often small and poorly ventilated, and knowing that there's been limited or a lack of product labeling, they often don't know what some of the chemicals that they're exposed to are. Many of these workers, especially in the case of California, but as we hear in New York as well, many of them are immigrant workers, so there's a lot of language barriers. And I always say that while some of the information on the chemicals are available in certain forms like the material safety data sheet, it really takes high literacy levels to be able to comprehend those. So you can imagine that if you're an immigrant worker, being able to understand what you're exposed to and having to find that becomes harder and harder because they're just not readily available. So you have a situation where a lot of the focus around health and safety is really put on the workers themselves, like these are things you should be doing to protect yourself, when we really should be looking at the manufacturers that are putting a lot of these ingredients in the products themselves. Next slide. So this is an abbreviated list of some of the chemicals that are of concern. We've listed out a few of the compounds, how they're used in a lot of the nail care products, and some of the potential health effects and the rate of exposures that you have. So you imagine that someone who is working in a nail salon is not just exposed to some of the chemicals through inhalation, but also through skin absorption, or if they're eating food in the salon, a lot of these things could be getting into the food, and so they're ingesting a lot of it as well. So you can see the list really, this is just an abbreviated list, but it is a long list, and there's a lot of concerns that we have in terms of endocrine disruption and reproductive health, and possible cancer links as well. Next slide. So there are three chemicals that are of great concern for us. They're called we've labeled them the toxic trio, and they include dibutylphthalate that is put into nail polishes and makes it a little bit more flexible. It's also an endocrine disruptor, and it could also cross through the placenta and actually have a lot of reproductive health effects. Formaldehyde, which is often used as tool disinfectants in the salons, and also a nail hardening agent. It was also used in a lot of the hair straighteners. And the reason why I bring that up in the salon case is that oftentimes you have salons that do both hair and nail. So you have a mixing a lot of these chemicals. And the health impact there is that formaldehyde is in the books as a known carcinogen. So we know it is directly linked to causing cancer. And then you have toluene, which is put into nail care products to really keep the pigments from separating. And it, again, is also an endocrine disruptor and can cause reproductive and developmental effects. And in California, in a number of years back, I think about 5 or 6 years back, we actually had the California Department of Toxic Substance Control start actually looking at nail polishes and sort of what their label was. And at the time, there had been a lot of focus on the toxic trio, so we had more and more manufacturers that were creating these toxic trio-free types of nail polishes. But when the department actually did the testing of a number of these products, they found that there were some products that were claiming that they were toxic-free, but they actually had like these chemicals in them. So they may have had toluene, even though they said they removed these. So really, it highlights sort of the vulnerability of the workers and consumers in terms of trusting a lot of these labels. Next slide. So for our work, I'm at Asian Health Services, but I'm also with the Cancer Prevention Institute of California, and we actually started partnering with Asian Health Services as research partners, and we were funded by the California Breast Cancer Research Program back in 2005. There's been a mutual interest around the chemical and occupational chemical exposures, as well as Asian Health Services hearing a lot of these issues coming from their communities. So their community health workers were going out to nail salons to do health education, and hearing back from the workers themselves saying, you know, I've been kind of concerned when I work in the salons that I'm getting these headaches, and then when I'm off work for a few days it gets better, but I really have very limited choices in terms of workplaces that I can go to, given sort of my immigrant status or sort of my limited English proficiency. So we knew that this is an area that really is arising in the community, and partnered with Asian Health Services to conduct our first study. Next slide. So in our first study, we did 2 focus groups, and this is early on when there hadn't been a lot done around this. There had been some work in Massachusetts. We did 2 focus groups, one with the workers and one with the owners, and then we were able to go out and into the salons to do about over 200 surveys with workers themselves. And this was a huge victory for us in terms of being able to get into the salons. At the time, you know, workers and salon owners were really fearful of the government really focusing in a very punitive way with the salons. So being able to go in and say, we're part of Asian Health Services, you know, and we've been around for almost 40 years, and we're here to try to understand what's going on. And some of our major findings was that half of the salons had poor methods of ventilation. What I mean by that is they may have had some ventilation machine, but it wasn't in use, or it wasn't properly in use, or they've had doors and windows that are open, but they weren't being open, partly because of the cold or because of sort of the neighborhoods that they were in. And so, you know, they are safety concerns. So we knew that there were some problems in terms of the ventilation. 80% of the workers were reporting a lot of health concerns as they were working in these salons, and about 50% of them were reporting what we call acute health symptoms like headaches, dizziness, difficulty in breathing, and skin irritations, a lot of symptoms that are often associated with some of the chemicals in the nail care products. Next slide. So then we created actually conducted a follow-up study, also funded by the California Breast Cancer Program. And what this initial study had 2 parts to it. The first part was that we knew that we had a really strong California cancer registry that captures about 95% of the cancer cases occurring in California. We were able to take that file and link it to the licensee file that I talked about earlier that we got from the California Cosmetology Board of Barbering and Cosmetology. And from that, we were able to get the rates of cancer in the workforce and be able to compare it to the general population. So if we were able to see that, you know, workers who were licensed as manicurists at higher rates of certain cancers compared to the general population, that might indicate that it may be occupationally related. However, in our results, we didn't find any excess cancer risk for any of the cancer sites. And part of that, I would say, is that, you know, when we were looking at the workforce, the ones that we're looking at were fairly young at that time, and that they had only been in the workforce in terms of being licensed as a manicurist in the last 10 years or so. And for those of us who study cancer, we know that cancer does have a long latency period and may take longer to develop. So we still want to do some of those follow-up studies. Next slide. As a second part of that study, we actually said, well, we really need to do some air monitoring within the salon. So we actually did what we call personal air monitoring, and you can see the badge in the picture below. In this, what we would do is we would ask workers to wear a small monitor clipped onto their collar, and what it does is it captures some of the chemicals, and we're able to test for them. We have them wear it during their time that they're doing their during work. So it was able to capture a few of the chemicals, such as toluene. And our results did show, when we were able to test it with about, I believe it was 80 salon workers, that toluene levels were twice as high as the recommended indoor air. Now, we didn't compare it to the occupational levels because our concern was that those levels that are set occupationally are really high and really not very sensitive to some of the worker health issues that we were concerned in hearing about. So we decided to look at California's recommended indoor air level. We also did area monitors. So those are not the small badges, it's the bigger monitors that we set. And those are somewhat limited based on where you place the monitor, but we were able to do a few and detected one of the chemicals called methyl methacrylate. MMA has been banned from nail care products since 1974 in its monomer form. We were still detecting it in the air of salons, which suggests a few things in terms of how they were how the polymer forms, sort of the bigger forms, were really being put out into the air, or if people were not really realizing that it's been banned and using it in the salons, and it could really cause a lot of health problems. We also look at total volatile organic compounds, which is sort of a more of a summary measure of some of the organic compounds, and found that these levels were high too. And then for the workers, we also did a survey with them during their work period when they were wearing the badge, and we were asking how they were feeling, and of course, more than a quarter of them were reporting a lot of these health symptoms such as headaches, skin irritations, and breathing problems. Next slide. We also conducted another study, and I think Swati, one of our speakers, will be talking more about the Healthy Nail Salon program. But San Francisco did pass a groundbreaking ordinance that allowed them to establish a Healthy Nail Salon program. So we work with Swati and the San Francisco Department of Environment in evaluating that program. And in this study, funded by the EPA, we were able to recruit 6 of the salons that participated in this in the pilot of the Healthy Nail Salon program, and then compared them to 5 salons, this comparison group, who were not participating. And in that, we use a very similar method in which we had people wear their air badges during their work period, and then actually doing surveys with them. We did find a reduced level of toluene in total volatile organic compounds in some intervention salons, but because of the small sample size, it was not statistically significant. We also found that in terms of knowledge and such, that there was increased awareness of chemicals in nail care products in the intervention salons compared to the comparison group. Next slide. In addition, our research group also conducted I guess the slides aren't coming out very well, sorry about that, but what we did was we did another linkage study, but instead of cancer, we wanted to look at some of the reproductive health problems within this workforce. So we took the same licensing file of manicurists and cosmetologists, and we were able to link it to the birth file. So imagine any woman that gave birth during this period, we linked it to their child's birth records. And the birth records was really nice because it was able to show us some of the adverse reproductive outcomes that were happening. Of course, it's limited to whatever is recorded in the birth file. So that's, you don't have the neurodevelopmental health issues in the birth file just yet, because those may develop later on. So in our study, when we linked it to the birth records, we found that for birth outcomes, there was an increased risk of small for gestational age among Vietnamese manicurists and cosmetologists when compared to the Vietnamese general population in California. And then we saw maternal complications. So when the woman is pregnant, there was an increased tendency for them to have gestational diabetes among both the manicurists and the cosmetologists, as well as increased risk when we restrict it to just Vietnamese manicurists and cosmetologists. And that study has been published in the International Archive of Occupational Environmental Health if you want to read more on that. Next slide. So right now we're actually in the middle of actually entering into our 4th year of NIH, National Institute of Health funded R1 study, in which we are doing a huge intervention with the nail salon. So this is what we call a randomized control trial, where we would recruit a number of salons to actually participate. And it's a very general idea. The general idea is sort of the train-the-trainer intervention. We would recruit the nail salon owners, train them on best practices to reduce chemical exposures, and then have them turn around and train their workers. And in order to evaluate the effectiveness of the intervention, we conducted the personal air monitoring for a number of the chemicals, as well as conducted surveys to see improved knowledge and behaviors that would really reduce chemical exposures. We were able to roll this out in 4 regions. We actually have just completed 3 of the regions, Marin and Contra Costa County, Alameda, Santa Clara, and then we will be rolling it out to Southern California in the coming year. Next slide. So there are 5 things that we really recommend in this intervention. The first and foremost has always been the using safer alternatives, reducing the toxic chemicals before they even come into the salon. We have always emphasized that that is the first line of defense. And then after that, we talk about ventilating the nail salon stations and the nail salons themselves, protecting their hands and face so that there's not the exposures for them, and then proper ways of handling and storing of the chemicals, as well as other best practices such as taking breaks and such, just to reduce their exposure. Next slide. So our design is such that we would recruit about 90 salons. We break them down by the regions, and then we would randomize the salons into an intervention or a comparison group, and we would conduct the owner training. So before we actually conduct the owner training itself, we would actually do the first assessment, the baseline assessment of both the air monitoring as well as the surveys. And then after we conduct the training with the intervention owners, we would conduct another mid-intervention assessment, including air monitoring and surveys. And then the owners would turn around and train their workers, and after that, we would be able to do a post-intervention. And then for the comparison group, we wouldn't do anything except for a delay intervention well after. So this is a way for us to evaluate the effectiveness of the intervention. Again, we're still in the midst of the study, so I don't have any of the findings to report to you, but so far from what we can see, there's been some improvement in terms of knowledge and best practices. And I should say that in terms of the intervention, when we train the workers, we have them use the flip chart. And the flip chart shows what they're presenting to the workers, but in the back there's talking points for the trainers themselves. So it's really an easy way of doing a presentation within the salon itself. Next slide. These are just some pictures of us training the workers, the owners themselves. You know, they really get into it. We bring an industrial hygienist to talk about a lot of the ventilation. We give them exercises to really improve their health, and a lot of them are experiencing ergonomic issues. We teach them how to read the labels and really check the labels with a lot of the material safety data sheets. Next slide. So really quickly, next slide, in terms of research gaps and emerging products. I just want to say that, when conducting research, it's really labor intensive when we're working with a lot of the immigrant population, especially in the small business sector. There's language barriers. There's also cultural issues that we really face since we started on this. A lot of times we hear the workers say, well, I have no choice. I really need to make a livelihood. So if that means at the expense of my health, so be it. So we really have to work with some of that messaging. And sort of the risk that's posed to their livelihood. A lot of times they feel very threatened by this. Then there's also the worker-owner dynamic, which I think really comes to play. But we really start from it in terms of knowing that a lot of the owners are workers themselves, are from the community, so really getting them to work collectively. There is a high turnover of workers in the salon business and the salons themselves. We often would go to a salon and work with them, and then in a couple months find out that they've been shut down because they're not making a profit. There's also a high distrust and fear of the government due to historical experiences in Vietnam, as well as interactions with the inspectors that go in from the Board of Barbering and Cosmetology. There's just a lot of trust issues there. And then a very low health and literacy population, particularly the Vietnamese workers in California. Next slide. And then one of the challenges has been that every time we try to focus on some of the products, it's constantly changing. There's always new trends and such. So some of you have heard about gel polishes that have really come out, and those are sort of put on, they look like nail polishes, but you have to stick it under the UV light, and there's a lot of issues and concerns that we have in terms of what's in it, how hard it is to remove, and some of the chemical that workers and consumers could be exposed to as they're using a lot of these gel polishes. And then there's also the concept of regrettable substitutes. So you may be pushing for them to ban chemicals like dibutyl-phthalates, but what we're seeing is a higher use of triphenyl phosphate, which is also linked to adverse reproductive outcomes as well as endocrine disruption. So we're really not helping when we focus on just one chemical, and then having them another chemical may not be that much better. Next slide. So in terms of the research gaps, I think we really want to focus on better exposure assessment. How do we capture not just one single chemical, but be able to capture multiple chemicals, and looking at how the synergistic effects of these chemicals and how they interact with each other. The time exposure to sources, so not just saying you shouldn't be exposed to dibutyl-phthalates, but really teaching people where is it coming from and how do you really minimize that exposure. And bowel monitoring, being able to look at urine samples and blood samples and know that, it's not just what's in the nail care products, but that it's really getting into the body of the workers. That's really important for us to show. And then a need to really do a longitudinal study on not just cancer and such, but respiratory problems is a huge concern for us, as well as reproductive. A lot of times people are going in and doing a lot of these cross-sectional studies, and it really is a selection bias, because we always say that the really sick workers have probably left the workforce already, so you're really not getting an accurate prevalence and incidence of a lot of the health issues that they're facing. And then my concern has always been the moving target when it comes to a lot of these emerging products. That's just as we're establishing sort of the health impacts of some of these chemicals, new products come out, and then sort of as researchers, we're always trying to play catch up. And then emphasizing, I think, the role that consumers can play in a very service-based industry. So, if consumers really want to help improve the health of both the workers as well as consumer safety, then they really have to use a lot of their buying power and really be able to patronize businesses that are, trying to provide a safer workplace for the workers themselves. Next slide. And with that, that concludes my part of the presentation, and I think Julie is going to be switching over.
Thank you so much, Tu. Now we will turn it over to Julia, who will share Health Center's response to this issue from a social determinants of health approach. Julia?
Hey, thanks, Nina, and thanks again for helping to put this great webinar together. Good morning, everyone. My name is Julia Liao. I am with Asian Health Services and also with the California Healthy Nail Salon Collaborative, and really excited to be talking about how, as a community health center, how did we actually start addressing this issue. Next slide. Just a little bit of background about Asian Health Services. We're a community health center. We're 41 years old as of this year, started in 1974, and we originally began as really a volunteer organization, just seeing about 100 patients a year. We had a volunteer doctor who actually is still on staff with us now. She's a pediatrician who started seeing kids, and all of her patients still love her, and so they still see her, and they're all adults. We're now a multi-tiered clinic with many comprehensive programs, and really, again, our roots are in the civil rights movement in the 1960s and early 1970s. Next slide. So now we've really grown, and we have multi-sites. So not only 3 primary care medical homes, but also school-based and dental-based clinics. We have now integrated mental health and primary care. We also have 2 dental clinics. So we've come quite a long way from back in 1974. Next slide. And our mission really is around services, but also advocacy. It's really, those are 2 pillars from which we move and conduct our services. And we provide all of our services in actually 12 different Asian languages, regardless of income, insurance status, culture, or language. Next slide. So we serve over 25,000 patients annually, and because we see such a wide range of Asian populations, one key population that we see is the Vietnamese community. And back in 2004, we had a community health worker who was doing outreach in the Vietnamese community, focused on diabetes and the importance of health insurance, but began hearing a lot of stories around the health issues that many community members were facing. Because when she was doing outreach, where would she find them but actually working in nail salons? So a lot of her outreach was focused in nail salons. And many had shared that they were experiencing a lot of health issues, many of which you had heard earlier by Dr. Quach. So, next slide. Many of the stories that we were hearing were around folks having a lot of headaches, nose and throat irritations. This is a quote from one of our patients. really feeling that had so much irritation within their nose and throat that they had to cough and really excuse themselves constantly from work. Next slide. This is another quote from a patient about experiencing asthma and lung problems, respiratory illnesses, and then 12 years later finding out that she was diagnosed with breast cancer. And not understanding if there was a connection or not, but asking a lot of questions, and actually decided to stop working as a manicurist, feeling that perhaps she was sacrificing her health because of her of what she was doing and working as a nail salon worker. Next slide. This is another quote from a patient. Many of the workers have experienced concerns around reproductive health impacts. A lot of stories of workers experiencing miscarriages, other reproductive health problems, but again, questioning, is this due to the chemicals that they work with? So definitely something that started to be seeded as, well, what is the connection between my health and my work? Next slide. So as our community health worker came back and reported all these stories, pretty much everyone that she reached out to had experienced some type of health issue and were continuing to experience acute health symptoms and even concerns around cancer and reproductive health. And in response, Asian Health Services felt like we needed to be able to address this issue. This is actually an epidemic that we felt like we were seeing in the community. So really, again, calling to our mission about, not just services, but also advocacy, going beyond our four clinical walls to really look at this as a social determinant of health, a root issue to the cause of what was happening to our patients that are experiencing all these problems. Next slide. You can keep clicking. So essentially, Asian Health Services in 2005 established the California Healthy Nail Salon Collaborative. And the California Healthy Nail Salon Collaborative is a statewide coalition made up of 30 organizations throughout the state that cut across environmental health, reproductive justice, and public health. We knew that in order to address this very complex problem, as Dr. Quach had mentioned, from regulatory policies to the broken system, to the lack of education, to the culturally competent linguistic materials that were needed. This is a really complex issue, and this wasn't something that Asian Health Services could do alone. So bringing in all of the experts in the field to really come together and how do we actually address this issue on multi-levels. So if you want to click the button. So a lot of our strategies are multi-tiered. From research, we have a research advisory committee. Our chair is Dr. Quach, leading a nation of experts who are industrial hygienists, researchers, and a lot of other folks who have a lot of knowledge around research expertise in this area. And we also recognize that we need to do community organizing and base building because we need to hear from our patients, from the community, around what are the issues that they face, and then also what do they see as solutions. Click one more time. And then making that connection because education and training is very important, but then the question is what's next? Well, the what's next is, well, what kind of things can be made? So also thinking around policy advocacy, and I'll talk a little bit more about that. Next slide. So the California Healthy Nail Salon Collaborative, Asian Health Services is a key steering committee member, and they gather together its members on a quarterly basis to discuss strategies, to really figure out, well, how do we come together? We're all very diverse in our organizations and our expertise, but how do we organize ourselves so that we can create greater impact and really, again, address all of the issues that are embedded within nail salon work, health, and safety. So for example, next slide. There's a focus on the education piece. So Asian Health Services works with the collaborative to hold health and safety training workshops in Northern California, really around best workplace practices, how to reduce chemical exposures. We have brochures in our clinic, so if patients come in, they'll know immediately. If we find out that they work in the salon, here is some information and strategies that you could use to implement within your workplace. But we also do the trainings here at the clinic as well. And the collaborative overall does trainings statewide, also in Southern California. And these are all materials that are translated in Vietnamese, and they are done at a level that is appropriate to the literacy level of the community. And these are all pictures of our different workshops and regional convenings. We also bring together owners and workers on a regular basis to, again, talk about the issues that they are seeing within their community, but also as a way for us to also teach them tools and skills to be able to think more deeply about advocacy and about what they can do in their workplace. Next slide. You can keep clicking. And so this is a picture. We know that, you do the trainings, and we also take a very select group of folks. They nominate themselves to go through leadership development trainings. And these are very focused trainings. They're done on a monthly basis, and they're skill building opportunities where they can just learn basic things like note taking. How do I share my story? How do I talk to my family members and friends about nail salon worker health and safety? Because this is really an issue that many workers and workforce members were very, very scared to come forward and talk about. This is their livelihood. Many were fearful that, wow, if I start talking about this, I'm going to lose my job. Our customers going to want to come in and see me. So there was a lot of training and a lot of trust building that we had to build. And I would say it took us a good couple of years to be able to do that. And we now have 30 core leaders that we've trained who have gone through empowerment and skills building training. So we're very excited about that. The next slide. And so the trainings and the empowerment and the skills building have really led us to be able to lay a very strong groundwork for policy advocacy. We also have, the collaborative also has organizations that have expertise in policy. And this is a picture of one of AHS's patients who is actually at a legislative hearing, and she is testifying and sharing her story. She has breast cancer and also has been very concerned about the chemicals that she has used in the products and concerned around the lack of accountability of manufacturers to be able to have safer products. And so again, she's gone through our trainings, and she was very, very brave to come forward and share her story to a broad public arena. Next slide. So what the collaborative did, and Asian Health Services as well with its other members, really focused at first on statewide policy, but realizing that was really challenging. And although the Safe Cosmetics Act of California was passed, and that requires manufacturers to report if their products contain toxic chemicals, we knew there needed to be more to be done. And so on the local level, the collaborative's key members, which included Asian Health Services, Asian Law Caucus, and the Environment California, went to San Francisco to work on some local policy as a strategy to really think about maybe we need to do local strategies in order to be able to pass something wider spread later on. And so we worked closely with Board of Supervisor David Chu, who is now an assembly member at the Assembly in California. And he was a champion for a program that actually was a solution that was brought up by the community. And this was around being able to recognize salons and shops that actually prioritize health. So rather than taking a very punitive approach and going in there and regulating all the shops and saying, these are the things you need to do, a lot of the workers and owners said that they did not even know what are the different types of workplace practices that they should be implementing. And so taking this sort of carrot approach, it was an incentive program. And I know Swati will be talking in more detail about it. but it was really about incentivizing shops to really use the safer products and alternatives that were out there without the toxic trio, using appropriate ventilation, and really implementing best workplace practices. And really, this picture is an event that was held to really promote this local ordinance, the Helping Nail Salon Recognition Ordinance. And it was to really, again, publicize to the media and overall to consumers that there is a way to be able to support strategies to improve worker health and safety from a carrot approach. So next slide. So this is a picture of community members and also patients who came forward who really felt like, because this was a solution they felt was the right way to start this trend of health and safety in the workplace, in salons, really saying, hey, this is a program that we need and it should be passed. And so next slide. And as a result of that, it was really exciting, the first Nail Salon Recognition Program Ordinance was passed, and it was really groundbreaking in San Francisco. And it was really a model, and has been a model for so many other counties and cities. Right now, San Francisco was the first. Santa Clara just passed a Healthy Nail Salon program as well, and San Mateo, and Alameda, and the city of Santa Monica. So right now there are 5 counties and cities who are implementing these programs in the state, and up to around 70 is the estimate of salons that will be recognized as Healthy Nail Salons. And the San Francisco Department of Environment has been an integral partner and so key to all of this, because they laid such the important groundwork around the criteria and really being a model in San Francisco that others could follow. Next slide. And so this is just a picture of different owners who have been recognized as Healthy Nail Salons in Alameda County and San Mateo County. They receive a certificate that they can put in their salon. Some counties have decals. Again, Swati will go into a little bit more around what San Francisco is doing. But again, this has been a really exciting program where shops, again, can be rewarded for prioritizing health. And consumers are also can see that this is a shop that is really thinking about consumer health as well. Next slide. And so in terms of next steps, Assemblymember David Chu has now established a statewide Healthy Nail Salon Task Force with the intent of being able to pass legislation that can support the nail salon workforce and consumers to really prioritize health even more deeply. So Regional Services and the Collaborative are key task force members, and we are excited to really be able to move the models that have worked in this community forward, and really looking to other counties for their leadership as well. And we are continuing to train a cohort of leaders to really embed Healthy Nail Salon concepts, to really help foster the pipeline of workforce members to really be a part of these Healthy Nail Salon recognition programs. And so with that, I would like to, I have a next slide with questions. I know we'll take questions at the end. But I know Swati, again, will talk more deeply about the Healthy Nail Salon recognition programs themselves. So
great, thank you, Julia. Now we will hear from Swati, who will share key local partnerships and approaches to address this issue. Swati?